Good afternoon, Tom Ginn. Own Your Own Health. We'll be right back. Good afternoon, Tom Ginn. Own Your Own Health. Today, I'm really excited to bring in a guest, but I'd like to start out a little bit about Own Your Own Health, why this platform has been created. You know, we live in a culture today that a lot of people are not doing well physically, and there's many different types of holistic solutions out there and modalities. We just want to bring in guests that have expertise in different modalities, different methodologies to help people improve their life, improve their health. And so that's the whole platform that we want to do. Every week, we're going to have different guests on. And the guest I'm bringing in today, I met at a networking event, and she was sharing what she did. And I said, she's perfect to bring on this program because we're dealing in some areas in the health area, in chronic illnesses, in the area of diabetes too. It's at a crisis level in our country. And my guest today, I'm going to read a little bit about her here. Dr. Jelina Shah is a clinical pharmacist and a holistic diabetes health coach for people with type 2 diabetes and prediabetes. Jelina specializes in diabetes-related holistic health and has successfully helped hundreds of patients decrease their blood sugars, have more energy, feel confident about the food choices they have, and educate them about their medications. And it goes on here, and I'll leave that the rest of it for her to share. And Jelina, are you ready to come on in?
Hi.
Good afternoon. Good afternoon.
Thank you so much for having me.
Share a little bit about where you're from, your background a little bit, you know, what's brought you to here. I believe we call that your story and your why today. So just go ahead and introduce everybody to the audience.
Hi, my name is Dr. Jelina Shah. I'm a clinical pharmacist and a holistic diabetes health coach. Thank you again so much for having me here today. I am located currently in Los Angeles, California. I recently moved out here during the beginning of quarantine, so it's been an interesting move. But I work primarily with patients with type 2 diabetes and pre-diabetes. And the reason for that is diabetes, it's a passion of mine because it runs in my family. My own dad has diabetes, and I've had several family members struggle with and have even passed away from complications related to diabetes. So it is something that's really near and dear to my heart. It impacts me personally. And how I got here, I've always had a love for medicine, and a real big curiosity. And my background, since my parents are from India, there's a lot of Eastern and Western techniques that I've, have bared witness to. And I really have always seen, like, especially nowadays, there's an opportunity to marry the two. I think it's important to not only treat the biological aspect of a disease, but also the emotional, the spiritual, the social. Like, we're whole people, like whole beings and whole souls. We need to treat everything in order to get to the root cause of what's causing our own struggles and issues. So that's why I kind of got into this. Is I saw an opportunity working with lots of patients with diabetes that when we started to focus more on what else was going on in their lives and treating them as an entire human, like being with all of their struggles and obstacles, they were starting to succeed not only with their diabetes, which was the main, benefit, but there were benefits in their relationships and how they were feeling. They were sleeping better. They had more energy, and their moods improved. And so I have such I delight in giving people all sorts of information. And like I said, I like to marry both Eastern and Western parts of medicine as much as I can, because I think the Eastern part's been around for a long time. And the Western part, being a pharmacist, I understand it. And I think there is a need, especially in acute settings. So.
Okay. So you're a licensed pharmacist or schooled in pharmacy. And how long you been in that profession?
Yeah, I received my doctorate in 2007. And so I've been a pharmacist since then.
Okay. And you work predominantly in a pharmacy or a hospital setting or a private practice with somebody, or?
Yeah, so in the beginning of my career, I was at a retail pharmacy, at the grocery store, and it was not fulfilling to me. I wasn't able to educate people the way that I wanted to, especially in their health. And then from there, I received an opportunity to work at Kaiser Permanente in Colorado. And they really, for 9 years, I was with the company. I really loved it there. I had a lot of experience working with people with their all sorts of ailments, not even just diabetes, but everything from heart issues to anticoagulants, the whole spectrum, osteoporosis, everything. And from there, I just was looking for a change, and I moved out to California, like I said, at the beginning of quarantine. And I worked at a as a clinical pharmacist in a clinic where I worked primarily with patients with diabetes and on anticoagulants. And then I decided to branch out, and I opened my own business just within this last year in November to put all my focus into this holistic care for patients that have this disease.
Well, I commend you, going outside the traditional career path. That's gives you a strong scientific background. Because I always believe that, if we're talking holistic, I believe there's got to be the validation and science behind what you're doing. And we'll talk a little bit about what is holistic solutions, and what does that look like, and the validation that you use, because I know that a lot of people in your profession really want to make sure that they're doing it, providing a solution that is validated, that's going to give a benefit. And so diabetes, let's talk about this a little bit. There's 2 types of diabetes.
Mm-hmm.
And why don't you share with the audience the 2 types of diabetes that there is, what the difference between the 2, why you're doing diabetes 2, and what do you see in our culture about diabetes, and maybe some insight about what's some of the root causes around that.
Sure. Yeah. So type 1 diabetes is a diabetes diabetes has to deal with insulin, which is a hormone we make in our body. For people that have type 1 diabetes, their bodies are unable to make insulin. And this actually, back in the day, would be a big cause of death for people way back in the day, because your body does need insulin in order to function properly. So when we eat food, it turns into sugar, also known as glucose, into the bloodstream. And when there is no way for that sugar to be eaten up, it can cause a whole onslaught of health issues. So type 1, we make no insulin. Those people have to be on insulin in order to survive. It's not a choice. It has nothing to do really with their diet or anything like that. It's just something their body isn't producing. The difference then is type 2. What happens with type 2, some people have a genetic predisposition like myself. There's also there's kind of like an external factor, like environmental factors that get in. So it's what we put into our body. A lot of times what happens is it's called insulin resistance. So the hormone isn't functioning appropriately. It's not working to the ability that we need it to work to. And so what it does is, because it's not working to its best capacity, people end up having a lot of health issues related to that. It can lead to things like you're twice as likely to have a heart attack or a stroke. Because it affects the blood vessels, it includes the ones to your eyes. That's why blindness is common with people that have uncontrolled diabetes, or kidney issues like dialysis, amputations. You're not getting enough circulation. So, you have more illnesses. So insulin is really, really necessary in order for us to function and to be healthy. And so with people with type 2 diabetes, that insulin is just not working the way that it can. And it's primarily affected by what we eat, or we might have a genetic predisposition also.
Okay, I have a question.
Sure.
Going back to diabetes 1, does that onset at birth, or can diabetes 1 show up later in life as well?
Man, this is a little complicated and a little controversial. Often diabetes type 1 will show up early onset. They used to call it juvenile diabetes for a reason, because it would come off when like kids were when you were a kid. There is another type of diabetes called diabetes 1.5. So it's kind of a mix between diabetes 1 and 2. And that's why diabetes type 1 typically does not show up later in life, but there are some people, and this is where the controversy lies, is that there are some people that actually stop making insulin. And so they don't technically have type 2 diabetes, they have type 1. And this is like after the age of 30. So, I mean, most of the time type 1 diabetes is younger, and type 1.5 and 2 is later onset.
Okay, because I was just curious. I've known some friends that had a child that was diagnosed with diabetes 1, and that started that process with the insulin shots on a regular basis, and then of course we know what's happening. We know about a little bit about diabetes too, but I just wanted to get some clarity there for myself as well as our audience out there. But before we go any further, I have to do a disclaimer from my behalf of what I do with our wellness center and the products we do, because we're in a supplement industry, and I don't want anybody to get confused that what I'm doing is making any sort of diagnosis. So anything, just for clarity, what I'm talking about here with the question I have is that it's nothing been evaluated by the Federal Drug Administration. I'm not here to diagnose, treat, cure, or prevent any diseases. That's outside my scope. I'm not a doctor. The products I'm associated with, I have to make that little disclaimer. So I'm going to turn it back to you on that.
I know you also asked, so the thing with type 2 diabetes, and the thing that I find, the CDC does say that by 2040, 500 million people in the world will be diagnosed with type 2 diabetes, or will have some form of diabetes. And that's a lot of people.
Yeah.
And there is a way, like prevention is really key for, even if you have a genetic predisposition like myself, you can work really hard to try to prevent yourself from, or do the best that you can to help your chances of not getting diabetes. So, and I know that with the patients I've worked with, the biggest barrier or struggle is a lot of times when people are diagnosed with type 2 diabetes or receive a diagnosis of prediabetes, there's a lot of shame and denial that come with that. Because the fact is a lot of people think, oh, I just have been eating too much sugar, or I know I'm not eating the way that I'm supposed to, and I've put myself into this situation. And so I've found that I've had a lot of people come in who have been, struggling with even dealing with what's causing them to eat the way that they are, because it ends up being a cycle. The food makes them feel good, because let's be honest, like, we know carbohydrates taste delicious, and pizzas and pies and cookies and chips and bread, like, we know they taste good. And there's a response from our brain, like we get a dopamine hit. It's a hormone in our brain it's a pleasure hormone. And so anytime we eat these foods, it was biologically set up for us to enjoy them. And that's because back in the day when we were like foraging and hunting, if we saw a fruit tree, our bodies needed to eat as much as we could. So we needed something in our bodies to tell us like, yes, this is the time to eat, because we didn't know for how long we'd be fasting, because you'd go days without food. So it makes sense biologically why we were wired this way, but we are no longer in a situation where we're going out and picking fruits from the trees. You know, we're going to the grocery store and there's an abundance of food. So we kind of have to reteach our bodies what, like, that we're not in crisis, and that we have, that things are abundant and available and they're not scarce, because we're just kind of hardwired that way. So I think some of the source of diabetes, like type 2 and people struggling, it has to do with that.
I got a question is, you know, so we're talking about diabetes 2s, and it can come up at any age or whatever. And you're going to talk a little bit about some of the root causes why we're having what I call an epidemic, a crisis. You mentioned, by what year was that again?
Oh, by 2040.
Population, how many billion? Half a billion?
Mm-hmm.
Yeah. And what are you seeing? Are you seeing younger people? Usually what I've heard in the past, it was usually people aging in the process and start getting that diagnosis. But what are you seeing with the younger people with diabetes 2?
Yeah, this is why it's really hard with, you know, they changed the label from juvenile diabetes for type 1, because we are seeing lots of younger patients come in with type 2 diabetes. Unfortunately, the diets that some people have been, you know, so people have been coming in at younger and younger ages. Because, yeah, Tom, for sure. Like, you know, I think years ago, there was definitely, it was more of an older generation that was coming in with the type 2 diabetes. But nowadays, they are coming in younger and younger. People as young as like 13, 14 are getting, you know, diagnosed with type 2 or pre-diabetes. Unfortunately, and it does have a lot to do with what they're consuming. And again, because a lot of that food, it tastes good, it's easy, it feels like it's really cheap, and so there's just not enough education out there about what is actually healthy and how to kind of train your body to appreciate different foods. Like our taste buds have been hijacked by these hyper palatable foods. I mean, there are a lot of, the food industry is really to make, you know, and it makes them a profit. Like they're making sure that the crunch factor is exactly right and that the amount of sugar is right, which hijacks your taste buds. And so we kind of become kind of helpless to the food if we're not paying attention to what we're consuming.
Yeah. So diabetes 2 is probably the biggest root cause, if I'm hearing you correctly. A lifestyle thing. It deals with a lot of issues. I think just our diet, it triggers that. And then, of course, probably other lifestyle decisions could cause that to move quicker. So lifestyle, what would be, you know, besides going to a doctor and they do the blood test and do all those things to determine whether you're pre-diabetic or you were already a diabetic, what would be a trigger? What would be a something that somebody's out there that, you know, some people just don't go to the doctor regularly, you know, for one reason or another. But what would be some of the things that somebody would say, something's not right here? Can you speak to that?
Sure. The symptoms usually are like excessive urination. You'll have excessive thirst. You may notice some unexplained weight loss. You know, you'll feel really tired, fatigued. You might have headaches, like really bad headaches. But you know, the body is really good about trying to bring things to what I like to call homeostasis, which is like back to normal as much as possible. So sometimes, like, I think our labs are, even though we're overweight, if you tend to be a person that is overweight, you are at a higher risk of these things happening. So even if your labs aren't quite reflecting these things now, it's still good to pay attention because your body's so used to trying to put itself into like regular, make everything work, that sometimes we don't even know. So it's good to know these symptoms, like I said, excessive, urination, excessive thirst, headaches, all these things. It's a really good idea to go see the doctor to see if what's going on.
Yeah. And that brings up what you do here is that, when we talk about holistic, so why don't you share a little bit about what's that mean in relationship to the diabetes, to traditional treatments that, we go to a doctor and they may prescribe medication. They may make recommendations about diet, but what I found out from my personal experience, they don't really dive deep into the alternatives. They just say your blood test, and this is what we're going to recommend you to do. What is the holistic approach that you help people that are pre-diabetic or in that stage already? Could you clarify what a holistic approach is, what that might look like?
Yeah. So like you mentioned, my background is in medicine. So I do go over medications and how they're helpful, and which you'll usually get at a doctor's appointment. But I also like to make sure, I think there isn't enough time a lot of times at the doctor's appointments. So I want to make sure I give my patients like a full education. They come to me and I educate them not only about their disease and what's actually happening in their body. I take the time to do those things because I think it's important to understand so you know what you're contending with. And I also I spend a lot of time on diet, but the holistic things I also talk about is we talk about what's going on with you socially, what's going on with you. We talk about how you're feeling. Are you ignoring your hunger cues? Are you paying attention to why you're craving something? Because these cues, we've become so used to numbing ourselves from these cues, or we want to be a part of the clean plate club because we don't want to waste food, but we don't look at what the food's actually doing to our body when we override the cues that we naturally have. Are we reaching for the chocolate because we had a really, really bad day, or we had a breakup, so we decide we're going to eat a pint of ice cream instead of calling our friend, and letting our friend know, like, hey, like I need some help. And so my holistic approach is I like to do a tailor-made or personalized approach to what that person is particularly struggling with, because every one of us have different things that trigger us to seek comfort or need help, or may trigger us to eat or not want to exercise. And for me, it's very individualized. So I look at that particular person and treat each person very specifically based off of what's going on in their life. So, they may have social aspects where they have to go to parties all the time, or their family may start to question, like, why aren't you eating? And so we have to come up with, ways to help them feel comfortable in social situations. So it's not just like the beginning appointments are always a lot about like educating about what to eat and stuff. But towards the end, like I introduce things like meditation and, walking and exercise and just trying to be mindful and, journaling, gratitude practices. All of these things all have a place in our health. So.
Yeah, so holistic. So you do a full assessment and sort of get a feel of their lifestyle. What do they do when they wake up in the morning? What's their normal day about? What their normal week's about? And so that you can maybe start bringing some attention to them, that maybe these are areas that they should consider modifying or changing or doing something different. So
yeah, it's a collaborative process. I don't come up with meal plans. I don't believe in that kind of stuff. The way I think about it is you should eat what you want to eat, but is there a way we can have you eat that's more nutrient dense? That still like it's still enjoy. I don't want people to not eat. I don't want people to have to count calories. I don't want them to be like doing strenuous workout regimens. What I want them to do is to come into this with as much ease as possible. So we make a lot of small changes. What I love is my patients or my clients, they they thrive, because once they start to notice that they are feeling better, they start making more and more and more changes. And pretty soon I'm like, who was this person the person I was talking to 3 months ago is not the person that's here right now.
Right. And I could relate to that, as I've been, just only through awareness can we, understand and be able to make changes. I've made some changes in what I eat. I eat more vegetables and more fruits, and I've cut my red meat diet almost all the way out, and I've shrunken that down. And guess what? I feel better. And once I started noticing things, I said, "What else can I do?" This feels good. When I had a piece of steak the other day, I go, God, I didn't feel good. It was I hadn't had it for a long time ago. Now I understand why I felt the way I did all the time when I was eating those things. And it's just through that awareness. And I'm more excited to try something new because, I'm 72 and I'm blessed that I don't have anything chronic going on. The doctor said, you got to lose a little of this because it may lead to some of the things you're talking about. But I don't have anything chronic or no prediabetes or anything like that. But I want to avoid it. And I think that's where what you do is through awareness that don't wait until a symptom comes up.
Yes.
To take action. Create a lifestyle so that this doesn't become something that changes your quality of life, your ability to do the things we all want to do as we age as well, or when we're young. So, what do you do to talk about a little bit about the mind side? Because I do some things in the area of personal development coaching, and I understand the power of the mind and how that affects how we address our own health, how it affects us at a neurochemistry level, having the right mindset. There's a lot of science behind that.
Yeah.
So what do you recommend for people? You said meditation, and a lot of people don't understand what meditation is. And how valuable it is. Why don't you share a little bit about how important it is to have the right mindset, quiet the mind down so that you can feel better?
Yeah, I've had patients have never done any type of meditation. And so I start with a guided meditation, but I wanted to show them the power of what their body does. So it's like, even if you're like listening, if you like close your eyes for a second and you start picturing a lemon, like how round it is, and like you squeeze it and how soft it is, it has a little give, and then you imagine cutting it and you smell it. I bet most people right now, their mouth's watering a little bit. And the reason for that's how powerful our mind is. And so I like to dive into that. That's like something I want to show people is like, okay, you can actually feel and taste this lemon, even though you don't have a real lemon. And that's how powerful our mind is. So we can, this is how we eliminate cravings. This is how we learn to like get more in tune with ourselves. The more we can imagine what is possible for us, even a life that's possible for us. Like I have patients that initially come in who want to do things. It's not that they don't want to. They want to. They want to be able to play with their kids and have more energy and do these things, but they just don't have the vision because they just don't know. So some of the meditation stuff comes to envisioning what it's like when you become the person that you feel like you are in the inside, because you are that person. You just have to think like, in my like that, like her or him. Like you have to put yourself in their place, and that's the key. I'm like, okay, well, is healthy Jelina making this decision, or is this Jelina right now? Because healthy Jelina, she doesn't eat like this. I know she doesn't, because she likes to feel really good. And it's just kind of like implementing some of these mindset things. Like, do you know when you're actually hungry? Because a lot of people don't know. Like, and it's understanding like, okay, if there's a scale, I have like a scale thing where I talk about, are you hungry enough to like want to eat your arm off? Or are you so full? It's like Thanksgiving and someone's going to need to roll you down a hill because you're just so full. Like, we don't pay attention to the nuances in between. And when we start, it's like you said, the awareness, it really makes a big difference. And so so I do some of that kind of mindset stuff. And we know with journaling and stuff like that, even if you can't meditate, but journaling is great. It brings things from the back of our head, which is where our flight response is, and the amygdala, to the prefrontal cortex, which is where our processing and rationalization part of our brain is. So when we do stuff like that, it helps us move through emotions. So then instead of turning to things like food or alcohol or drugs or gambling or shopping, we're actually looking inward, and we're able to kind of suss out what's making us upset and process those emotions.
Yeah, you mentioned a lot of our food. What was it? Is it dopamine or?
Yes, dopamine is a
The
hormone.
feel
Yeah.
good.
Yes.
Meditation and going to a quiet place, it triggers the same thing. You get a good feeling.
Mhm.
And once you recognize it, you can use your mind to offset that craving or that thing that you're trying to seek, whether it be an addiction, whether it be whatever, those habitual habits that they're sometimes. So I believe your mind has a lot to do with how you feel, and feel good through proper thinking. And I believe also, and you tell me if you agree with this, is that if we think about illness, we become ill.
Yeah, I definitely agree that where we focus our energy, that's where it's going to go.
Yeah.
And so if your energy is focused in, I don't feel good, I don't feel good, I don't feel good, the science has shown that we have something called confirmation bias. We're going to find every single piece of information that supports and is evidence to that belief. And so confirmation bias doesn't always have to be bad. It can be great too. And when you change your identity, because that's the other thing, we identify sometimes with being unhealthy. But when you start to identify as a healthy person, you show up different.
Yeah.
If you identify as a person that's always late, guess what? Chances are you're going to be always late. But if you tell yourself, well, actually, I'm a person that's always on time, or hey, I'm a morning person, you'll be a morning person. So it's important to identify yourself, put these labels on yourself that are helpful and move you forward, because how you talk to yourself, that's the other thing I do a lot with my patients, is the self-talk. Because a lot of the self-talk is negative, and I know from personal experience how difficult it can be when your self-talk is so negative. And again, coming back to that confirmation bias, I would find a million things that would support the evidence that I'm not enough, or not smart enough, or not good enough. And when I started changing my self-talk, and I got to be really like, oh, is that actually true what I'm saying? It's like, no, actually, that's not true. When I started changing my self-talk, I started showing up different. And I noticed that when I started showing up, people around me started showing up different too.
Absolutely. So. Yeah, we can get off into that whole thing, but it's relevant to our health.
Yeah.
Many times people in personal development, they talk about the physical world and the things you draw to you and all that, but our health will respond the same way. Mm-hmm. And just like through a new level of awareness, you've seen diabetes in the stages that no one really wants to go. Do you paint that picture, what the outcome might look like if they don't make a decision to change their lifestyle? Do you go to that place at all with them?
I mean, I'll give them, I have to be frank, I will give them what could happen, because it's important to know what could happen, but I'm not into scare tactics, because at the end of the day, I don't think, for me, I don't think scaring someone is really conducive to what most people are coming to me already scared, already feeling, worried and concerned, and me piling on like some more weights on their shoulders isn't going to help. I think most people, it's important to have an awareness. Like, do not get me wrong. I want to make sure people understand, like, yeah, your chances of certain things happening are higher, like heart attacks, strokes, like it's double. I also want to make sure that I emphasize that this isn't a death sentence, that this isn't something that they can't live with, that this isn't something like technically, okay, it can't get reversed, but you can go into remission without drugs. And I have helped so many people do that. You don't need to be on medications, obviously with the help of your doctor or whatever, but you can control it or many people can. Some people do need the medications, but many people can control it without always needing medications either, by changing how they're eating, or they can delay the onset of needing medications by being more cognizant and aware of what's going on. I'm a big believer in what can you achieve, because that to me is far more motivational, like to know where you could go. Because a lot of my patients, they have hopes and dreams of living a long life, of being the healthy person that I think a lot of people come to me and they're like, I don't feel like I feel my best, and I want to feel the happiest and the healthiest version of myself. And I'm like, I can help you get there. Like when we work in collaboration to do that, that's the big thing.
The reason I brought that up, I've heard different people use that worst case scenario as an emotional shock, because lots of times change behavior, there's a lot of research about it, but people really change behaviors at an emotional level.
Yeah.
So if they're coming with fear, you want to guide them so they can deal with their fear and give them hope. Yes. And they have to take responsibility, right?
Yes. There is a lot of accountability. Yeah.
Yeah. Because I've heard different ways that different people bring out the worst case scenario. Is that the direction you really want to go? Most people probably have enough awareness that they know enough family members and in our community that they hang around with. Somebody has diabetes. They've seen people with amputation lose their sight, numbness, all those things that come along with that. I was just curious, because I've heard different ways to bring people to a different level of emotional change.
Yeah, in my experience, that often scares people more than it's helpful. And then they retreat more and it depends on how it's presented, but it kind of feels more shame and blame based then. Like, well, if you don't do this, like you're gonna, and my approach is, I want to come from a much more compassionate, loving place. Like, because that's when you need the compassion. When you get a diagnosis like that, you don't want someone to come down on you and say like, hey, you should have done this and you could have done this and you need to do this. Like, you want someone to say like, man, this really sucks right now. And I'm so sorry you're going through this, but I can help you. I'm here for you. Yeah. And that's my approach.
I appreciate that you're expressing that, because a lot of times people may be in a situation and somebody does the negative thing. And I love your approach that, so because a lot of the things that we need to change is behavior to make those different choices. What have we been conditioned to eat, and why do we eat what we eat, and when we eat?
Yes.
A lot of people deal with turn to food to stuff emotions. Yes. It's usually not food that we're looking for, that feeling, right? So we eat the carbs, the ice cream, the sugar, the French fries were loaded with sugar, all the carbs, right?
All the carbs. Well, we want to discharge our feelings. It never feels good to be sad or lonely or hurt or whatever. We want to discharge those feelings immediately. And a lot of people have learned to cope in all sorts of different ways, whether it's like watching Netflix for hours at a time, like when you should be doing something else, or if it's food, or if it's alcohol or drugs. I mean, really, it's just discharging those feelings. And if we would just spend 5 minutes in the uncomfortable feeling, a lot of times you will find some of these cravings, some of these issues that you're having will pass, because those feelings, they're not meant to be there forever. Now, if they're there for long periods of time, again, go to your doctor. There might be like some other mental health stuff going on.
Sure.
And no shame in that. But most of us will go through the feeling, and it will only just take a few minutes of just acknowledging, journaling, meditating, prayer. I don't care what your spiritual background is, pray to the universe, to Buddha, to God, to whoever. It doesn't matter. But prayer and all of those things, like where you can just feel your feelings for the few minutes, and then it allows you to finally release and process it. And that's what you need. And that's the best, I think, and in my opinion, the healthiest way to deal with things that come your way.
Yeah. So now you're working through that. You're working with your patient, your client, to become a different level of awareness, show a holistic approach, what that looks like, and then let them. I think once they make a choice, it's the most important thing. It's their choice.
Yes.
When a person makes their choice,
yes,
out of proper information, proper motivation, they own it. They will do it.
yes,
But they don't do it when they're dictated. You must do, just like the fear thing we talked about. So now you've worked your client through all the sphere. It's not a circle. I call it a sphere of holistic. What else do you do? What about nutrition? We talked about food. What about supplements? Those type of things. Is there any protocols they should be aware of? Being a diabetic, is there anything people should be aware about taking nutritional products?
Yeah. Thank you for asking that. So I have a background in medication therapy management. I have a certification. I did it for like 9 years. And what that basically means is like, I have an expertise in all like medications aside from my PharmD. I did additional, like I'm board certified in pharmacotherapy and ambulatory care too. So I think it's so important that you go to someone, especially if you're on a lot of medications, and you find someone that can go through the prescriptions with you, go through your supplements with you. And before you start anything new, to make sure that you talk to the pharmacist or your provider first. And the reason for that is there are so many interactions out there that I can't even tell you about. There's just so many. And it's not even just with the supplements and the drugs themselves. It's also with things like food, like grapefruit really affects a specific liver enzyme, which affects all sorts of medications. And so there are foods out there that also can contribute to your medication's not working as well or causing side effects. So I really am a big advocate that if you're going to take a supplement, if when you're starting new medications, that you talk to the pharmacist and bring in the entire list of your medications, especially if I know these days it's so expensive. Medications are so expensive. So we might get something from one pharmacy and do it at another pharmacy. So bring the entire list to one place and have it all written down and have someone go over it to make sure that everything, cooperates together. Sometimes you've got to space things out by hours. Some things do need to be taken with food. Some things need to be taken on an empty stomach in order to work its best. And so it's important to make sure you have all of that information, because sometimes we don't receive it when we, just show up and pick up something because we're in a rush or something's going on or we're distracted because we've just started a new medication. So I think it's really important to reach out to your pharmacist, reach out to your doctor, and make sure you look at all of those items.
With your background, you're working with a client that I'm just trying to draw a picture. So you haven't put this all. Do you actually work with their physician or at all, or collaborate with their physician?
I have in the past, and
Okay.
I have in the state of California. If I have an agreement set up with the physician, I can actually change and start and stop medications in the state of California only. But I do work with people because I am virtual. I can work with people anywhere. I just can't, make changes in medications with anyone outside of that. But I have worked with doctors. I think it's important that everyone is included in this, because this is, especially when it's your health, like you want to make sure that every person is privy to what you are doing so that we're all communicating. And so I do, reach out. The Doc, depends on the office. You know how it is. I'm sure people have tried to call for their own prescriptions or try to get a hold of their doctor. It kind of just depends on who you're talking to. But some people are more receptive than others. But this is why it's really important, like, to be an advocate for your own health, to make sure that if I can't get through, that you're at least talking to the doctor as well. This is why it's important to be your biggest champion. And pay attention, because even though I'm talking to the doctor, I try to get labs and stuff too, if I can, because I want to make sure things are dosed appropriately based off people's kidney function and their liver function, because all of those things can also have a impact on what's going on inside your body, particularly.
I was just looking at your notes here, and I was just seeing if there's something else I wanted to bring up.
I do. For anyone out there, this is like not related to type 2 diabetes, but for anyone that's like a caregiver or is a person that's on a ton of medications and they're just like, I don't even know what to do. I don't know where to start. Those people can also reach out to me. I'm available. I have a one-time program where I go through everything. I look for drug duplications. I even look to see if things are cheaper on their insurance, because that's a big deal. Like, you could be taking something that's in the same family, but it doesn't cost as much. And, I try to collaborate with their doctor, and I write out a list of like what you're taking, when you're taking it, and why you're taking it. Because I think that's important too, to know why you're taking something.
Yeah, what you just stated there is within our practice, our wellness center, we have a retired, still licensed pharmacist. She works in geriatrics, and she does the inventory assessment of what's going on. And because you've probably seen it, sometimes older people say, you know what, it is expensive, I'll just take half a pill.
Yeah.
Or they'll forget, or they don't have a protocol set up properly, or those type of things. So I think older people, there's different reasons why they should have an assessment of their medications, because our biochemistry, how things start getting processed, less efficiency as we become older. We took something 5 years ago. We can't take the same dosage day because our body's not processing it the same way because of age.
Yeah, that, and I've even had younger people with diabetes. One of the first things I do is I go through everyone's medications, because I've had several cases where people are taking duplicates and they don't even know they're taking duplicates, because the medications, they're in the same family, so they're doing the exact same thing, and they're getting one from one pharmacy and the other from another pharmacy, and sometimes if it's coming from the same pharmacy, which is very problematic, but we have to, so they're taking all this extra medication, which is wreaking havoc on their body unnecessarily too. So it's possible for anyone. So that's why it's so important to know what you're taking and why.
Yeah. And that's education. We, as consumers or people looking to become healthier, we don't know where to turn. And I'm so grateful that you've taken your professional schooling to go out and assist people, that there's an alternative. There's a way to manage your health, because we own your own health. That's why I came up with it. It's my responsibility. And the more informed I am, I can make better decisions for myself. Ultimately, that's going to affect me. It's also going to affect my family.
Yes.
If I become not as healthy as I am now, what is that going to do to my family as well? The stress that puts them under, the economics that they go through, the lifestyles have to be changed, all those dreams we have about as we age. So what you're doing here is so important. I think the earlier people start questioning, I believe questions are the most powerful thing we have. And you've probably seen it. And we just take what the medical professional says as absolute. I believe asking questions when they make a diagnosis or make a recommendation. What are the alternatives? What are my choices? I think important.
I think curiosity is definitely key. I think to stay open and curious to what information you're receiving. And I will say this, I have seen and this is not, I love doctors, and I'm not saying anything, negative, but they just have limited time with you.
Yeah.
So if you do not get discouraged. That's my one piece of advice for anyone out there. Like, please don't get discouraged if you're not getting the answers you want from that one particular person. Go and find someone else that can help you, because there are so many of us out there that want to assist and have the capability, or they can come to a podcast like this or to your wellness clinic and ask you, like, hey, where do I get more information about this? And you guys have resources. Like, someone like me has resources to assist you. So even if you get curious and you ask a question and you feel like you got turned down, like, do not be scared to stay curious and advocate for your health.
Yeah. It's so important. We're like to, can you do what you do outside the state of California if you had a, okay.
So I'm licensed in California and Colorado as a pharmacist.
Okay.
But what I do is diabetes holistic coaching. So, outside of the pharmacy, so I might not be able to stop and start your meds outside of those states, again, without a collaborative agreement in the state of California. But everywhere else, as far as the information I give you for nutrition and mindset, and the information about the medications, like how they work, what works, all of that stuff, I can definitely, that's not, information that's just for Colorado and California, that I can do everywhere.
Okay. And we got something scrolling here. I just want to make sure people know how to get a hold of you. We got your email scrolling across so that people can reach out to you. Perfect. And I'm going to put this here and let that scroll across. And we have your website as well. Let that scroll a little bit. They can reach you through your website. They can contact you through your email.
Yes.
So, and you'll respond back to them, I'm sure, quite quickly.
Yes. Yeah.
But we have a couple things that we want to share out there that you are providing an offer. And I'm going to have you explain your offer right here.
Yeah. So as a special, just for the listeners here, I wanted to offer a 60-minute session with me. If you want to address your struggles or obstacles, or you want to take a personalized approach, like a tailor-made approach, especially if you have type 2 diabetes or pre-diabetes and you want some assistance, feel free to reach out to me. That's definitely one thing. I also, like I said, I offer a program to help with all medications. If you're really lost and struggling, you can please feel free and reach out, and we can schedule that as well. But yeah, my offer is it's 60 minutes with me. We really try to figure out what's going on, what's triggering you, and hopefully get you happy and healthy as soon as possible.
And so that'd be that HTTPS.
Yes, So if you, copy and paste that, that'll get you to the scheduler. If you are like, I don't know what's going on here, go to the website. It's all on there as well. And it's called the Type 2 Transformation. Feel free to get in there. And then also, as a bonus, I have a downloadable PDF that I am offering. And it's the number one question I get when people first are diagnosed with diabetes is, what can I eat? And so I have a PDF. It gives you a visual guide and some written instructions. It's a quick little thing for you to look at and just kind of, that's where you can start. So, feel free to jump on the landing page. Again, you can go to the website and download, sign up for it there as well. But that is the best place to maybe start your health journey.
Wonderful. Yeah. So I just want to encourage those out there, tag and share. We know a lot of people that are concerned in this area of diabetes, and many times they just don't know where to turn, what's reliable information. We get on Dr. Google, and I don't believe that's the place we should go. For real information. There's other research centers, places out there, but reach out to professionals, people that have scientific backgrounds, training, because like I say, Dr. Google, I don't believe is the best place to get the information.
I like to view myself as like a pharmacy curator, like an art curator, but for pharmacy, like for medical information. I can help you weed out what, like if you go through Dr. Google and you find all sorts of things, it's hard to know what's relevant and what actually pertains and what is just a bunch of misinformation. So I like to think of myself as like a little curator, a pharmacist curator over here. So bring those questions to me and I can help decipher like what is true, what has been shown to be true, where the studies have shown things are working, and what is actually like misinformation, so that it can help bring some clarity in the process, because it can be so overwhelming when you type in something like type 2 diabetes into Google, because there's all sorts of information.
Right. Well, thank you very much for taking a step out there to approach this. I call the crisis. That there are solutions, there's hope, and somebody that can guide you through the process in a way that is loving, caring, empathetic, customized to that person's desires, I think is so important. I think not their wants, but their real desires that they want for themselves and their health. So I'm really excited for you making that decision to become an entrepreneur, taking your passion and to love what you do to help and serve people. You're going to be going to help a lot of people.
Thank you.
Yeah. So we just want to make sure people are tagging and sharing out there. Again, I'm going to put up the information to get the downloadable form there. And let's see. And we want everybody to just tag and share this information out. One person, if we just share it with somebody, I call it the ripple effect. You drop a pebble in the water. We never know where that ripple is going to land. And it can make the difference in somebody's life in a very significant way, because they got a new level of awareness, new hope. And don't be afraid to share this out, folks. We live in a culture where we need people like Jelina out there taking approach. I'm not anti-pharmaceutical. I'm not anti-Western medicine. There's a place for everything, but I don't believe there's one silver bullet.
I agree. I think we have to treat a person as a whole person, right? And that's the way it should be.
Right. Well, it's been a pleasure, but I would like you to, leave a parting thought, and then we'll roll out of here. But what's the one parting thought of wisdom that you just like to share with anybody that's listening to this broadcast?
My parting thought would be that it's never too late to start the life that you want to lead. And it doesn't matter how old you are. It doesn't matter how much money you have. It doesn't matter all of that. Not to say that those things aren't important, but if you want to lead a way in your life, like, it's never too late. And, and that, especially with your health, you can start making changes now and do the best that you can to get to where you need to be. But just start.
I love that. It's never too late. Never too late. Well, it's been an honor, a pleasure to get to know you. We're dealing with a situation in our culture, and probably worldwide as well.
Yeah.
So you're going to make a difference, and I'm glad to know you, and I'm here to support you any way I can. And I hope to have you back.
Yes, I would love to come back. It's been great. It's been a lot of fun. Thank you so much for letting me share my message. And I really hope that, somebody gets a little nugget of information from this.
I'm going to put your website up here one more time.
Perfect. Yeah, that's the best way to get a hold of me. Yeah.
All righty. I'm going to put you in the back room and enjoy I don't put M&Ms in holistic practitioners' green room. Enjoy the fruit.
Thank you.
So, diabetes, there's a holistic approach. And I loved what she shared, everything from how we think about our health and lifestyles and everything she's doing. And she's going to make a big impact on a lot of people's lives. And just want to encourage everybody to tag and share this out. We all know somebody that has this condition that is plague. I call it a plague or a crisis. So share it out. Own your own health. It's our responsibility to own our own health, but it's only through new levels of awareness can we make a change for ourselves and our families with our health. With that all said, everybody have a blessed day, and we'll catch you next week.